This is My Child Will Thrive, and I'm your host, Tara Hunkin, nutritional therapy practitioner, certified GAPS practitioner, restorative wellness practitioner, and mother. I'm thrilled to share with you the latest information, tips, resources, and tools to help you on the path to recovery for your child with ADHD, autism, sensory processing disorder, or learning disabilities. My own experiences with my daughter, combined with as much training as I can get my hands on, research I can dig into, and conferences I can attend, have helped me to develop systems and tools for parents like you who feel overwhelmed trying to help their children. So sit back as I share another great topic to help you on your journey. It's episode 14 of the My Child Will Thrive podcast, and here's what's coming up.
Why do this? Why create this? It took me many years to find the right things to help her. And it was a really frustrating process. A lot of Googling, a lot of searching, but not knowing really what to look for and where the good sources of information could be found. And a lot of wrong turns along the way.
A quick disclaimer before we get started. My Child Will Thrive is not a substitute for working with a qualified healthcare practitioner. The information provided on this podcast is not intended to diagnose or treat your child. Please consult your healthcare practitioner before implementing any information or treatments that you have learned about on this podcast. There are many gifted, passionate, and knowledgeable practitioners with hundreds, if not thousands, of hours of study and clinical experience available to help guide you. Part of our goal is to give you the knowledge and tools you need to effectively advocate for your child so that you don't blindly implement each new treatment that comes along. No one knows your child better than you. No one knows your child's history like you do or can better judge what is normal or abnormal for your child. The greatest success in recovery comes from the parent being informed and asking the right questions and making the best decisions for their child in coordination with a team of qualified practitioners in different areas of specialty. Now on with the show.
I am coming to you this evening to talk to you about why I created the Autism, ADHD, and Sensory Processing Disorder Summit. But probably I should start here first. For those of you who don't know me, my name is Tara Hunkin. I am the founder of My Child Will Thrive, and I am the creator of the Autism, ADHD, and Sensory Processing Disorder Summit. And a number of people have asked me why I have gone to the trouble, and it was a lot bigger project than I ever imagined, I have to say. I'm thankful to have the support of a lot of people in doing this, but a lot of people have asked why do this? Why create this? And in particular, when you're looking at, there's 3 diagnoses there that are in the title of the summit. So I'm going to talk a little bit about that right now, so you get an understanding of why I came up with all of this. So it starts with obviously my story with my daughter, who didn't have a particular diagnosis when we first started. We just had a bunch of troubling symptoms. And it took me many years to find the right things to help her. And it was a really frustrating process. A lot of Googling, a lot of searching, but not knowing really what to look for and where the good sources of information could be found. And a lot of wrong turns along the way. And she's now 13 and doing quite well. And at some point over the last couple of years, I started to talk to her about whether or not we should share our story and the things that we learned along the way. Because it's obviously her story mostly. And she was very, very certain about the fact that she wanted to try to help other kids not have to go through all the trials and tribulations she did to get where she is now, and what we continue to work on so that she can be reach her potential in terms of all her skills and talents. So what does that mean? So part of our challenge, as I said, is that she didn't have a diagnosis. And when you don't have a diagnosis, you just have a bunch of symptoms. And what we found out over the years was that the diagnosis doesn't actually really matter. The only time it actually matters are for 2 things. One is to get access to some of the services, which is very important. And to get access to certain things for insurance, or depending what healthcare system or school system you are, sometimes the diagnosis is important. So for those things, and the only other thing that the diagnosis is important for is for your Google search. It's a starting place to help you narrow down some of the resources out there. And because we didn't have a lot of clear diagnosis for more than just one for some of the symptoms, but not for the rest of them, it was really, really hard to find the information that we needed. So hence the name of the Autism, ADHD, and Sensory Processing Disordered Summit, because what we know now is that really all these neurodevelopmental disorders are about a cluster of certain symptoms, and these symptoms overlap. And on top of that, there are a lot of kids that don't actually fall into a particular diagnosis at all. And so, but it doesn't mean the underlying causes of these symptoms don't exist. So the idea is to put together a bunch of really smart and very experienced clinical practitioners, researchers, doctors, nutritionists, product developers, in terms of certain types of therapies that will work for our children, and bring them all into one place online where you can listen to them talk about what they have learned from their education and experience and working with these kids, and where the research is leading us in terms of understanding what the underlying root causes are of these neurodevelopmental disorders. So, and all in one place online for free over a 10-day period. So from June the 19th through June 28th, you will be able to watch a few talks every day. They'll be live. Each of the speakers will have their talk will be live for 48 hours. And maybe we should just talk about some of the people that are going to be joining us over that period of time. There are over 25 different people that I have been interviewing. I'm almost done all the interviews. I'm really excited about that. I can't thank the speakers enough for giving me their time. They're donating their time to us as parents to talk about the things that can help our kids. So that's been fabulous. People like Dr. David Perlmutter, the author. He's a best-selling author of the books, many books, but two of the ones in the more recent past are Grain Brain and Brain Maker. And he's going to talk to all of us about the role of the microbiome on our neurological health for our children. There's lots of research going on in that area, which is really fascinating. And he's a board-certified neurologist and had practiced for many years clinically with his patients and used diet nutrition as a key component of the way he treated his patients. So there are people out there doing that and doing it successfully. We're also going to talk to Dr. Derek McFabe, who has been doing research in the area of the microbiome, in particular with respect to autism, for a many number of years. Again, Dr. McFabe is also an MD and has had clinical experience as well as his research experience. So it's a fascinating interview with him about what he's found. And also on that very same day, we have Alex Doman, and he is the founder of Advanced Brain Technologies and a really great therapy program called the Listening System that helps use music to train the brain. So not only are we going to be talking about things like biomedical interventions, so looking at the body's biochemistry and what might be going wrong with our kids, we're also going to start talking about how we can retrain the brain, because what we know now is that the brain has plasticity, and that means the good news is that means we can retrain the neural pathways to operate appropriately and bring back function that has been impaired by a number of different factors, which you're going to learn all about over the course of the summit. So that's the first three speakers. On day 2, we have Dr. Robert Melillo, and Dr. Melillo is the founder of their brain balance centers across. They're found across the United States. But even more importantly, Dr. Melillo has been doing many, many years of research and clinical practice in the area of how to retrain the brain and the impact of the brain on the body. And he's going to talk to you about things like primitive reflexes and how they impact the development of the brain and impair function in our kids, and why that is such a foundational aspect of how we have to look at moving forward and to correct the imbalances in their brain. And in particular, he wants to talk to you about the functional disconnection syndrome, talking about how the two sides of the brains of our kids, one is operating faster than the other, and that tends to be what causes a lot of the symptomology that they're seeing, and how that can be fixed, which is what the important thing. I tried to, with each of the speakers, we're going to talk about those underlying root causes, but the end game for parents is finding ways to solve these problems. So we tried to, with every speaker, talk to them about, okay, we know what the underlying cause is, but what do we do about it? And where can we find someone or something to help us do that for our kids? So we're going to talk to people like that. We're talking to, I just spoke with Trudy Scott, and Trudy is a nutritionist that is right now all the way in Australia, and had a great conversation with her. Her specialty is anxiety and how to use nutrients to help solve some of the anxiety issues that our children have. And the great thing about this is the interventions she's talked about, when they work very, very quickly. So it's definitely something to consider when you have a very anxious child. And unfortunately, as we discussed, like some of these things, you're not sure what comes first. Sometimes it's the sensory overload that causes a pile of anxiety. It could be other symptoms that are causing the anxiety in your child. So we're going to talk to her. We're going to be talking to Dr. Ernesto Gutierrez from the World Stem Cells Clinic. He's going to talk to you about how stem cell therapy could help your child, and what stem cells are all about, and why there's some really promising research that's being done in that particular area. And again, how that can help with the neuroplastic component of healing your child's brain. Let's go on. On day 3, we're going to be talking to Julie Matthews. Julie is also a nutritionist, and she has a great website called Nourishing Hope, and she has a great book as well called Nourishing Hope for Autism, where she talks about how to look at different therapeutic diets to help our children. And that can be a very complex and confusing issue for so many of us. So she's going to start to demystify that and tell you where to begin. I had the great pleasure of speaking to John Jennis the other day as well, and he's going to talk to you about the importance of the vagus nerve and how to build vagal tone back. And that's all about, our kids are always in what we like to call fight or flight mode, because of sensory overload, because of many, many reasons. A lot of them have chronic infections, they have digestive issues, many other things, and a lot of that gets right back down to their vagal tone, and how the vagus nerve is key in the autonomic nervous system. So he's going to talk about what that's all about, explain that to you, and then also talk about how he has developed some essential oil blends that can actually help you, which is a very easy intervention to work with your child, non-invasive and inexpensive way to help build back vagal tone and bring them into a parasympathetic or a resting state so they can heal and digest and do all sorts of other things that are key to their healing overall. We also have Dr. Peter Skyer, who is also a functional neurologist, and he is going to talk to you about interventions you can do even once your kids get into their teens, and how young we can start with the kids, really, really young, and the importance of self-care for parents of special needs children. He's going to talk about how he's worked with parents like us for many, many years, and I'm not sure I probably have to tell you that we don't take the best care of ourselves when we're working so hard on our children's health and well-being, and how that ends up causing challenges for the whole family moving on. So he's done a lot of work recently in the area of looking after the moms in particular, and the dads, and making sure their health is in line as well as their children. So we're going to be talking to him about that. I have Dr. Christopher Shade on the next day. He's going to talk about neuroinflammation and things like the liver-gut-brain connection. How do we address neuroinflammation, so the inflammation in the brain, and what tools we can use to do that. It's a fascinating talk. We're going to be talking to Dr. New. He's got a very long last name, and fortunately he likes everybody to call him just Dr. New. So Dr. James New, he's going to come on and talk to us about something that's super important, again in the role of gut health and how why poop matters. He wanted to call the talk that Why Poop Matters, and it does, even those people that don't like to talk about it. I also have Dr. Natasha Campbell McBride, the creator of the GAPS diet, which is the Gut and Psychology Syndrome diet, which is a healing diet that, or nutritional protocol that helps our kids heal their guts and in turn heal their brains. So she's going to walk you through all the reasons why that protocol works and how to go about negotiating it, because it is a more complicated nutritional protocol to take on. I have Dr. Nancy O'Hara that's joining us, and Dr. O'Hara is going to talk to us about cell danger response. And this is really exciting because there's some new research that just came out last week from Bob Navio all around cell danger response, and a drug that was used for African sleeping sickness called Suramin. He just finished up a study on that has had really great results with, in particular, autism children on the autism spectrum in terms of reversing symptoms, because it's halting the cell danger response that Dr. O'Hara is going to explain to you what that is and why it's so problematic for our kids. I have Dr. Sonia McGowan, and she's going to walk you through if biomedical interventions are right for your child. And which is, it is something that, especially when you're first getting started out, what types of interventions make sense, and do I really need to do all these things, and what tests, and all those things are questions that run through our head. So Dr. McGowan's going to walk us through those things. And I have a great person on that day as well. His name is John Leon, and he's the founder of a fabulous website called the Autism Exchange. And he's going to explain to you why he created it and how it can help you. It's there to help you aggregate or find all the information you need in one spot, and it's vetted information. So he's got research that are fact-checking the information before it actually gets there, which is really fantastic. And I'll let him explain that fully to you. I also have Dr. Brandon Brock. He's also a functional neurologist and many other things. He is going to talk to us about PANS and PANDAS, which is a challenge that a number of the kids that have all these different neurodevelopmental issues get inflicted with. And that's because they have compromised immune systems, and they end up with this severe neuroinflammation, which causes anxiety, OCD, and tics. And so he's going to talk about how that impacts our children. I have a fabulous occupational therapist. You can just see you might see my dog walk in the background there. He's just walking by my window. I have a fabulous occupational therapist, Dylan Hartley, that has tons of work with kids like ours. And he's going to talk to us a bit about different interventions, but he's going to go into more detail on a particular tool called the interactive metronome and how that can help retrain the brain and work on that neuroplasticity component that I talked about. Let me just turn my page here. I don't want to forget anyone. I have Amy Berger. She's a nutritional therapy practitioner and an author, and she specializes in the ketogenic diet. And we're going to talk about what the ketogenic diet is, why it works or how it works, and what are the nuances of it, and when you might try it with your child. I also have a fabulous nutritionist and one of the MAPS, the Medical Academy of Pediatric Special Needs faculty members, Vicki Kobler, on. And she's going to talk to you about what she calls the ABCDs of a nutritional assessment. So she's going to walk through with you how she would assess the nutrition status of your child and how that connects to their symptoms and what you want to do next. I also had a great conversation with Richard Fry, Dr. Richard Fry. He is a fabulous clinician and researcher, and in particular, he's been doing one of the areas of research he's done recently is in the area of cerebral folate deficiency and how that can impair your child's neurologic health. They've shown very great improvements when this is addressed in a lot of children with, in particular, the research was geared towards autism spectrum disorder. But as I said, I would certainly consider it for other diagnoses as well. I also had a great conversation with Dr. Nicholas Dogris. He is a developer of a particular type of neurofeedback. It's called Neurofield. And fascinating story about how he came about doing this and how it works and why he and how he uses it with a number of different diagnoses to help retrain the brain. And then another colleague of his in neurofeedback, John Meckert, is going to walk you through what exactly neurofeedback is, what different types of neurofeedback are out there. And he's even done a demo video so you can see what does it look like if I take my child in to a neurofeedback practitioner. What is it going to look like? What will they have to go through in order to do this type of therapy to retrain their brain? And in particular, he talks about training the brain for self-regulation, which is a challenge for most of these children. Dr. Elizabeth Mumper talks to us about mitochondrial dysfunction. So this is when your child just doesn't have the energy to get through the day, but also their brain doesn't have the energy to process information. Mitochondrial dysfunction is found, unfortunately, in a lot of symptoms, but we often see it at kids when it's addressed, kids with speech impairment or processing issues, kids that have chronic gut issues where they're just not getting, they're chronically constipated. It's because they don't have the mitochondria in those cells are not generating enough energy to get the gut moving. So she's going to talk to you about what that is and how she looks at it from a clinical perspective when someone comes through her clinic door. Dr. Mumper is also a faculty member of the Medical Academy of Pediatric Specialties, among others. Most of the people on this summit lecture to practitioners, and then they do their best to also get to conferences with parents, as well as seeing patients in their own clinics. I also have another functional neurologist, Dr. Ryan Cedermark, and he's going to talk to you about how they go about when you have a child that's going to a functional neurologist, how they do a functional neurological assessment, and what the implications are too in terms of the gut-brain axis and how to treat the whole child. So how they look at that big picture and not just look at one thing in particular. On day 10 right now, I have Dr. Sydney Baker, and Dr. Baker is a fabulous resource in the area of in particular in the autism field. Dr. Baker has been working with patients he for decades, and in addition to that has been lecturing and educating other practitioners as well. He's also an author. He's going to talk to us about the importance of medical history and keeping a really good medical history for your child, and how that helps them identify symptom clusters, which he has over time been able to determine that these particular symptoms, clusters of symptoms, they translate into particular therapies that should be looked at. So he's actually used some of his background back from when he was at Yale, using information technology to gather and interpret data like that. So getting back to the basics of looking at the symptoms and how they cluster around certain things. I also have Dr. William Shaw is going to be joining us, and he is the founder of the Great Plains Laboratory, and he's going to talk to us about 3 key tests that are really helpful when you're assessing the gut health of your child. So testing is sort of a mystery to a lot of us. because there's so many different options out there. But he's going to talk to you about 3 tests that he feels are key to assessing gut health. So that's a lot right now, and hopefully we'll have a few more surprises down the road. But if any of those talks are of any interest to you, you should dive right in and go to the link, which I will link below this video. But you can go to www.mychildwillthrive.com/summit, and you can sign up for free. I encourage you to do that as soon as possible. That way we'll make sure we notify you when the talks are going live, and you won't miss a single thing. The other thing that you'll get when you do sign up for free is I have compiled sort of a conference and summit checklist. So it's something that I learned over the years. When I went to conferences, I at first got so overwhelmed with all the information. I did most of my learning online at first. It wasn't until the past few years that I felt comfortable leaving home and being away from the kids and going off to conferences. So even when I was doing online summits, like maybe some of you have attended previously or doing some online trainings, I'd often get through the training and I was all excited, and then I wasn't sure where to go from there. So the checklist that I came up with in terms of success will help you do that, some strategies to do that. And I'll also link a blog post I have below here from a few weeks ago about how I walked through that system of making sure I got the best out of whatever summit or conference I was attending, and tried to then turn it into actionable things without getting too overwhelmed when I got home. Anyway, I look forward to seeing you on the summit, and please share this with friends and family that you know could be helped by this information. Look forward to seeing you all there. Bye for now.
Thanks for listening to the My Child Will Thrive podcast. I'm so passionate about giving you the tools and information you need to help your child. For access to the full interview as part of the Autism, ADHD, and Sensory Processing Disorder Summit, please go to mychildwillthrive.com/summit. This is Tara Hunkin, and I will catch you on the next episode.